Hi, I'm your Realtor, David Locke, with Locke and Key Associates at Keller Williams, and my guest today is William Kinley, the CEO of AnMed Health. William, thanks so much for being my guest on my podcast.
It's a pleasure to be here. Thank you.
Well, you are the husband to Carol and the father of 2 children,
Yep,
and you came to us from Memphis, Tennessee,
that's right.
and you are a native of Virginia.
That's right. That's right.
So tell us how you got into healthcare administration.
Sure. Well, it's great to be here and talk with you about it. I love what I do, and I'm excited to be able to share. I got started, I didn't grow up in a medical family. I didn't have anyone in my family that were physicians, nurses, anything like that. But I was always interested in science, and had a great friend base that we were all kind of had those types of interests. And that's what really drove me. I thought I was going to either be a physician or a dentist. I was an undergrad. I was a chemistry and biology major. Was going to either go to dental school, medical school. Well, in the process of that, I was at Duke, actually in medical technology school, and my intention was to complete that and then apply to the other schools. Well, I found out that I really liked the administrative leadership aspect of healthcare. At that point, it was primarily in the laboratory, but it really perked my interest, and I shifted my direction over towards health administration, and was fortunate to get into a great program there at Duke and move on from there. But that's what really drove me. That I found that maybe I wasn't really cut out to be hands-on providing care to people, but I really enjoyed coaching teams, working on improvements and the complexities that are all the processes in healthcare.
Well, what you do allows the doctors and the nurses to do a good job.
Well, I hope so. I mean, that's what a big part of what leadership is about, is removing impediments and making it easier to do the right things and good things. And I hope we can do that.
For sure. I think a hospital that's an excellent hospital is one that has excellent leadership. It doesn't matter if the doctors are great if they don't have good leadership.
Well, everything has to work together. And our team, we talk about, no one comes to AnMed for just one person or one thing. What they come to us for requires everyone to be able to work together well.
Well, for sure.
And there's a lot that goes into that.
For sure. Well, what do you think is the current status of healthcare in Anderson and in our state and just in our nation as a whole?
Well, it's a great question. It's a big question.
Big.
We have, I'll kind of start at the macro level. Everyone's heard that we have baby boomers that are aging. We have a lot of older folks now as a percentage in our country. So the demand and need for healthcare is being driven as folks utilize more healthcare as we get older. That's a challenge for us as a country and as a state. It's a challenge because the reality is the demand is going up, but yet the resources, either financial resources to pay for services or manpower resources to be able to provide those services. You've heard of shortages in physicians, shortages in nurses, probably the most common one you hear about today, is a real challenge for us. So those are some of the big hurdles that we have. On the flip side, though, healthcare is at a time that innovation and technology is just moving at such a rapid pace that it's very exciting, and bringing things to bear that will help people live longer and live better. And that's what we're really excited about at AnMed. That's what I'm excited about. We're not a tertiary academic center, but one of the other things that's exciting in healthcare is innovation is not just happening at the big academic center and a few sites around the country, around the world. It's happening everywhere, including in our organization, and it's exciting to be a part of that.
Well, tell me about some of those innovations that are happening at AnMed.
Some of them are minimally invasive types of things, being able to do procedures that in the past had required open surgeries. Now you can do them. Our physicians can perform those in a minimally invasive fashion. Orthopedics is one, neurosurgery is one. Another area is cardiovascular. I had a dear friend that had a new heart valve just a couple of weeks ago, and he's in his 90s. And
Wow.
It was a minimally invasive heart valve, and in the past, likely that surgery, the risk of an open procedure would have probably dissuaded them from even attempting it. But the minimally invasive valve that our cardiologist just perform probably one or two every 3 days. And AnMed actually allowed his heart performance to improve so much that his quality of life has improved.
Wow.
And he was not kept in the hospital. It wasn't a long recovery after it. So it's things like that. A lot around medicines, a whole lot about how we communicate and work together. One thing that we have, as Americans, we use lots of pharmaceuticals.
A lot.
And as we get older, we use more. And all of these things have to work together. One of the things that we've done in our network of physicians is we have a clinical pharmacy team now that works with the physicians and actually with those patients to make sure that they don't just understand the medicines, but they're not taking medicines that counteract one another. Everything works together, and keeping them on the most minimal amount of drugs that are possible. That's a huge innovation and a positive
for sure.
for patients.
I know a lot of doctors will say, if you're feeling bad, think about what you're taking.
Yeah.
Because so many times the side effects of the drug mimic an illness. Well, tell me, how does health care compare now with the way it compared to pre-pandemic times?
Well, there's been a lot of changes. The pandemic put pressure on our system that allowed us to see some challenges that we have. We might have been aware, but we were able to kind of not focus too much on them because they weren't really under stress at the time. A big one of those is the ability to provide staffing and surge capacity when you just have so much capacity. The public would think, and I know I would think that, and sometimes even our federal government will think that, well, just because you're a licensed facility at X number of beds, 500 beds at any given day, you could just take at least 500 patients, and that's not the way that it works. There isn't resources standing around idly waiting in case someone has a healthcare need. Because of the pressure to keep costs as low as they can and work at a higher value position, we operate kind of just in time, just like a lot of other industries do.
Can't be any waste.
And that's been a big stressor with COVID. Also, I think there's been more attention and still is learning around how you balance personal will versus the good of the whole.
For sure.
And that's a national discussion still, but we're kind of at the tip of the spear around whether it be masking or vaccination or even sometimes hand washing. But how do we balance those things? It's had an effect on some people leaving the field.
Really?
And it's also had an effect of bringing some other people into the field because they see how impactful they can be as having a life as a nurse or a physician or any other medical profession. So there's been some pieces there that have been helpful and harmful for us.
Well, how do you see AnMed relating to Anderson and our community? What is AnMed bringing to our community to make it a vibrant place to live?
Well, I'm very fortunate. We were looking for a place to move. We had been in Memphis for 15 years, so a long time. The longest we'd ever moved anywhere. But we was looking for a place that had success. I wasn't looking for kind of my whole career to be in turnaround situations. I would tell folks there's two kinds of hospitals and health systems that are hiring CEOs. One, if things are not going well, the other is somebody died, and neither of those are particularly good.
Hopefully, are retired.
Turnaround time. I was looking for a place that had success, but also had a hunger to build on it. A hunger to build on that and do more. And fortunate to have that in Anderson and at AnMed. So my goal is to help us accelerate and build on the good things that we have done over time, bring to bear some more things. We've brought some wonderful new members onto our team, wonderful new members. But we have so many connections in the community, and that is a strength that we just want to build on. There's so many things. We provide lots of care within our walls and all the sites of care that we have, really we have the ability to do more. When we say better starts here, we don't just mean better clinical care when someone has an accident or they're ill. We certainly do mean that, but really we think more globally that better life, more enjoyable, more fulfilled life. That's what we're after.
Certainly, that's what it's all about. You want to be healthy so you can enjoy your life.
And we're part of this community. This is a very joyful place to live.
It really is.
It's a special place to live. We want to build on that and be part of it.
Well, that's a good segue into my question of if someone is retiring to the upstate or they're looking to relocate here, what do you think sets Anderson, Greenville, the upstate of South Carolina apart? And that can concern healthcare or not concern healthcare. Why do you think it's a special place?
Well, we're relatively new. It'll be 3 years this fall that we've been here still. Some things that have just been particularly wonderful for us is the people are very, very welcoming. They are grateful and enjoy where they're living, and they want to share it with you. So I would encourage folks to get involved. We have a lot of folks that are making big life decisions to move their life here, and that's wonderful. And what an honor that people want to come live here with us.
Sure.
But get involved, meet people, and get involved. People really want you to. And Carol and I just felt so engaged from day one. Really, that's important. From a healthcare standpoint, we have a large primary care network. The first thing that really needs to happen, I think, is I would recommend they find a primary care doctor. And we have a multitude of ways that they can learn about what options there are out there. Build a relationship with a primary care doctor as soon as you possibly can. It's better that you build that relationship when you really don't need it than waiting until you do. We have a lot of wonderful practices and providers, so you can connect with that. So that is another way. And then the third way I would say is we would always be glad to share information and help folks learn more about what their options are in regards to emergency care or urgent care or rehab, whatever it may be, so that they can be aware as they're making decisions. We'll have people, David, that'll call us and say, I'm moving to the upstate. I have this condition. What would you recommend? Or I have a family member that needs this. What would you recommend? And we're always delighted to be able to help them with their transition here.
Well, I know I have so many people that call me as a realtor, and one of the questions they ask about the climate. And then the next thing they ask me about, especially if they're a senior adult, is they ask me about health care. And I have so many people that they'll have a specific type of ailment, and I'll be able to say, oh, we have wonderful orthopedics, or we have wonderful this or wonderful that. And I know that AnMed is a wonderful place because I've been involved with the hospital forever. But go ahead.
I think I'm still learning, but it's always fulfilling to me to be able to share with them. Yes, we have these orthopedists, and I know them personally, and because that I think is something that is unique, can be unique for us
sure.
compared to others. The other thing is we have a tremendous electronic medical record system that we call MyChart, and people are more and more getting used to that connection is kind of a way of life for them. Their information's there, it's easier. We have a wonderful system, and that's helpful as well.
Oh, I agree. You don't have to call your primary care physician and go through the menu. You can just message them, and then the message is back just like you've sent a text to your doctor.
We're trying to make it as easy as other types of transactions are. I don't know if we'll ever really get there in healthcare because there's a lot of nuances, but we've made progress.
Oh, I think it's absolutely wonderful. Well, that's a good segue. How do you think AnMed compares to other hospitals in the nation and in our region of the upstate?
Well, a few things I would tell you. We participate in lots of benchmarking, lots of benchmarking around our clinical performance, around our financial performance, our patient engagement performance, and we compare well. We target being in at least the top quartile, in many of our metrics being in the top decile.
Wonderful.
Some things that we have that are kind of marks of excellence, if you will, is we are a magnet designated hospital by the ANCC. We're one of, I believe, 6, and roughly 15%, I believe, of hospitals across the country
Fabulous.
are ANCC designated. So we're very proud of that. So those are areas that we're working on. We also participate in the Zero Harm program with the South Carolina Hospital Association. So striving towards and delivering in many instances 0 hospital-acquired infections, things like that.
Oh, marvelous.
That'll make it safer for people when they come to the hospital.
Oh, that's wonderful.
We have opportunities, but in many ways we really compare very well.
That's terrific. Well, I mean, I was born at AnMed. I've unfortunately had to be hospitalized there a time or two, but I've had a good experience every time.
I'm glad. I hope you don't more.
Let's all knock on wood that we don't. Well, I ask all my podcast guests for their favorite quote because I collect quotes. So, do you have a quote or a life lesson you want to share with us?
Well, the quote that I think lately I've been thinking about the most is people don't care about how much you know until they know how much you care.
It's a good one.
That is so important in healthcare. It is so important. Most of us are not in a position that we're going to be able to judge the clinical processes and expertise, but you can definitely judge and discern if someone really is caring.
Mm-hmm.
If they're empathetic, they're really connecting with you and genuinely you're the focus of their attention. So that quote really has resonated with me recently, but that's one I would share.
I call it being authentic.
Yeah.
If you could choose the smartest doctor who doesn't care anything about you, or you could choose a moderately smart doctor or realtor or dentist or attorney who cares about you, you would go with the one that cares about you.
You would.
Because you're going to get better service ultimately and probably a better outcome.
You probably are.
Well, that is a wonderful quote.
And we hope to find folks that are both exceptional physicians, exceptional leaders, administrators, and can show that empathy. That's the quest, and I think that's where exceptionalism comes from.
Well, I think you're doing a great job doing that. And I appreciate you being my guest on
It's
my
pleasure.
podcast.
Thank you so much.
Yeah, and
it's
again,
an honor to be here.
Well, certainly. And again, William Kinley, the CEO of AnMed, and I'm your realtor, David Locke with Locke & Key Associates.